Okay, welcome to the next session of the Presidential Symposium. I'm Ted Siegel. I'm an associate professor in the Department of Engineering, and I'm one of the Symposium committee advisors. In this session, the Hofstra Northwell School of Nursing and Physician Assistant Studies presents the beauty and versatility of being a nurse. This session will explore the breadth and depth of the nursing profession through a dynamic panel discussion that highlights lesser known but essential roles within the field. The discussion will focus on the wide-ranging contributions of nurses who represent the evolving landscape of the profession. At the end of the session, there'll be a Q&A, and as you see in the aisles, there are microphones. Please use those microphones at that time so that we can pick up your voice for the recording. The moderator for this session is Dr. Stephanie Keating, the Program Director of Graduate Nursing in the Hofstra Northwell School of Nursing and Physician Assistant Studies. And Dr. Keating, the floor is yours.
Thank you. Good afternoon, everyone, and welcome to today's panel, The Beauty and Versatility of Being a Nurse. On behalf of the Hofstra Northwell School of Nursing and Physician Assistant Studies, I want to thank you for being here. I'm Stephanie Keating. I'm an associate professor of nursing, the program director for the acute care nurse practitioner program, as well as the assistant chair for the graduate program. Nursing is often described as both an art and science, rooted in compassion and clinical expertise. But too often, the image of nursing is limited to the bedside. While bedside care is the heart of our profession, it is far from the whole story. Today, we have the privilege of hearing from a group of extraordinary nurses whose careers represent the incredible breadth of our field. Our panelists bring perspectives from leadership, education, community outreach, flight nursing, informatics, and advanced practice. Each of them started as a bedside nurse, and each has followed a unique journey shaped by curiosity, resilience, and a commitment to improving healthcare and communities. Over the next 75 minutes, we will explore their stories, uncover the many dimensions of nursing, and reflect on how the profession continues to evolve to meet society's needs. My hope is that you leave inspired with a deeper understanding of the versatility of nursing and the many ways nurses touch lives and strengthen communities, both within and far beyond the walls of a hospital. So I'm going to introduce our panelists. We have Shannon Brienza. She's a student of the graduate program in nurse anesthesia, Hofstra School of Nursing and Physician Assistant Studies. Next to her, we have Justine Cerrone, who is a Sky Health Medical.
Except for we switched seats.
Oh, I'm so sorry. I didn't even look down the road. Sorry, excuse me. We have Lynette Wolford, who is a Deputy Chief Nursing Officer of Northwell Health. We have Christy Lowenstein, the Dean of Hofstra School of Nursing and Physician Assistant Studies. We have Deborah Riccardi, who is Assistant Professor at the Hofstra School of Nursing. Am I right now? Yeah, okay. We have Bernadette Tesnowski-Funk, also an assistant professor at the Hofstra School of Nursing. We have Nancy Warren, who's Assistant Vice President of Clinical Informatics at Northwell Health. And we have Justine Cerrone, who is a nurse in our medical flight team. So I'm going to turn it over to our panelists. If you can briefly describe your journey from bedside nurse to your current role.
My name is Shannon Brienza. I graduated James Madison University in Virginia with my BSN. I worked my first job as a bedside nurse at St. Francis Hospital on a medical surgical unit that specialized in cardiac patients. And then I transitioned to the cardiothoracic ICU at North Shore University Hospital. While I was a CTICU nurse, I applied for the graduate nursing program that I'm in now. So I'm currently a full-time student as an acute care nurse practitioner, nurse anesthesia, and doctor of nursing practice.
Hi, good afternoon. I'm Lynette Wolford. I'm the Deputy Chief Nursing Officer for Northwell Health. I started my career 32 years ago as a registered nurse in medicine, surgery, and critical care. And over the years, I've held many different roles, spending an ample amount of time in nursing education and professional development, but going back to school, earning a master's, postmaster's, and doctoral degrees. And I've been in this role for 2 years. And we have 22,000 nurses across Northwell Health, and my current role involves enabling all of them to be the best nurses that they can be in caring for patients wherever that might take place.
I'm Christy Lowenstein. I'm the Dean of the Hofstra Northwell School of Nursing and Physician Assistant Studies. I began my nursing career 27 years ago. I actually began as an LPN while I was still in my program for nursing school, then became an RN, worked at a group home, got a job in a hospital. And then I had progressive leadership experiences. So I moved into the education department as a staff educator, became a nurse educator when I finished my master's degree, and then the director of nursing education for that department. Then I became the senior administrative director for patient care services, overseeing operations and education. That was all at Zucker Hillside Hospital. Then I moved over to South Oaks Hospital as the deputy chief nursing officer in 2021. I spent 4 years there, and last October I came here to Hofstra in the interim dean position, and I became the full-time dean last month.
My name is Debbie Riccardi. Welcome, everyone. I started my journey, I'm not going to say how many years ago, but I started my journey with my bachelor's at Schneider Children's Hospital, which is now Cohen Children's Medical Center, at bedside on the adolescent unit. While there, I enrolled in school, received my nurse practitioner degree, and then took a job through the nursing education department at the Children's Hospital. Found my love in nursing education, stayed there for a couple of years until administration called me down to the office and asked, would I like to take this new role they're developing as Director of Community Outreach at the Children's Hospital? Not wanting to say no, I took the role of Director of Community Outreach, and there I stood for about 20 years, developed tools and skills to then come here as full-time faculty. I'm beginning my 5th year here in the School of Nursing. So for the last 4 years, I was full-time faculty and program director for our Nursing Workforce Diversity Grant.
Hi, good afternoon. So about 18 years ago, I became a brand new nurse. I started working in the cardiothoracic ICU/PACU at NYU Langone in Manhattan. And my love of nursing kind of evolved over the years. I became a nurse practitioner also in the same unit. I stayed with cardiac surgery, and I'm still currently practicing in cardiac surgery. And then I came over to Hofstra full-time about 5 years ago as an assistant professor of nursing, and I love working here and teaching students.
Good afternoon. My name is Nancy Warren. I'll just say I've been a nurse since the late 1900s, and I'll leave it there. I started my career as a peds ICU nurse at Cornell Medical Center in the city, and after about 2 years there, there's a point to this, they went live on an EMR way back when. And I kind of fell into informatics even at that point as the go-to person on that pediatric ICU nurse unit. After about 10 years, they were merging health systems, of course, and I became Peds ICU management at New York Hospital Queens, which was one of the facilities in that health system, rolling out EMRs, moving along. Once again, opportunity was presented for me to be the manager of informatics there, which I then transitioned into informatics, and that was when I left the bedside. They had rolled out their EMR a lot, and it was kind of a little lull, and someone said there's an opportunity at North Shore LIJ Health System that was just starting their EMR career. So I switched, went from management back to be a clinical informatics specialist at the corporate level at Northwell, and have now been here 16 years, progressing through all of the, not just EMRs, but any technology we roll out across the health system, and that's where I am today.
Hi, I'm Justine Cerrone. I have been a nurse since 2010. I started out as a PICU nurse, then I went to NICU, then I went back to a peds float pool. At that time, I got my master's, so I'm a pediatric nurse practitioner. I took a role as a PICU CNS, which is a clinical nurse specialist. After a few years, I went back to pediatric ICU, and then I switched to pediatric cardiac ICU. And about 2 years ago, I came to Cohen's pediatric and neonatal critical care transport team.
Thank you, everyone. Bernadette, this question is specifically for you. Did you envision academia when you started nursing?
Definitely not. So when I first started nursing, my focus was entirely on the bedside. I wanted to be a great nurse. I wanted to take care of my patients well, provide safe, compassionate care. Over time, though, my experiences kind of shaped my thoughts on becoming more than just a staff nurse. I enjoyed teaching new nurses. I enjoyed precepting students. I enjoyed sharing evidence-based practice. And gradually over time, I saw how rewarding it was to see students, to see colleagues, to grow in confidence and skill. And that spark, combined with a desire to influence nursing practice, opened the door to academia. I subsequently got my master's and then my doctorate, and that kind of put me on the pathway to academia.
Thank you. And Debbie, what was the turning point for you, leading you away from the bedside and to outreach and academia?
So I have to say the turning point for me was mentorship. So as I stated, I began my career on the adolescent unit at the Children's Hospital, and you get comfortable. You get comfortable in the unit, you get comfortable in your surroundings. And a job position opened up in nursing education to take care of a few units. My nurse manager, which to this day I thank her, as my mentor, basically came to me and said, I would love for you to apply for this. I believe you have the skill set. And it was me. So going out of my comfort zone, I took the journey into nursing education, where I found the love for education. And a backtrack for me is I have a degree in art and design, so I did not start in nursing. I really did not understand the breadth and depth of nursing until I was getting my degree in art and design and working in a dialysis unit. I then fell in love with nursing, but I already was on a career trajectory. So backtrack, took a few degree courses in nursing, and here I am at the bedside. Never knew that it was anything beyond bedside. I then took the journey for nursing education, and from there fell in love, as I said, with education. And as I mentioned, the role then opened up for Director of Community Outreach. Administration called me down, again out of my comfort zone. And he asked me, would you like to take this job, Director of Community Outreach? We don't have a job description. This is how I envision it. We would like you to take it, no stress. You really don't say no to administration, and another door that was opened. So once I took that journey, created that role, I was there for over 20 years, and that gave me the tools and the skills of grant writing and an assorted sundry of things, along with then obtaining my doctorate degree, to bring me into academia. So as I mentioned, I was program director for our nursing workforce diversity grant that was not renewed because of the federal government pulling it. But I had the skill set to do that here. So my role into academia was nothing I would have envisioned when I was in art and design, or nothing I would have envisioned when I was at the bedside. So all those open doors that I took in that journey is a different path of nursing.
Thank you. This question is for you, Christy. Who or what influenced your decision to pursue a less traditional path?
So I'm glad Deb answered her question right before me, because I think it's the saying yes to opportunities when they arise. Most of us work for Northwell, and you hear Michael Dowling say that all the time, right? It's, you say yes to those opportunities. And I think that every time I've had a change in my career path, it's because it was something that I didn't necessarily expect was going to happen, but I said yes to because it sounded interesting and it sounded like it was something that I could do. First with being in psychiatry, I wanted to be a school nurse or a pediatric nurse like most people. And then I decided to take that, turn into psychiatry when I graduated, because I found I really loved it when I was completing my clinicals as an undergraduate. And then, working as a bedside nurse, I anticipated doing that for forever and, getting advanced degrees but staying as a bedside nurse or a nurse practitioner. But then one day, one of the nurse educator at the hospital came to me, and she was going out on leave, and someone else was leaving, and they needed someone to cover the education department, and they said, "You're a really great nurse, and you're very smart, and we think that you can do this." And so I said, "Okay," not knowing what I was getting into, and I thought it would be boring, but I found that it was anything but boring, and I really fell in love with the education department. And so that really prompted me to want to go back and get additional degrees and to learn more so that I could bring that back to the hospital and back to the staff at the hospital. So I kept going, with those progressive leadership roles in the nursing education department. And then the person who was in charge of operations for the hospital took another job. And so my mentor, who was one of the prior CNOs at Zucker Hillside Hospital, Mary Beth McManus, she said, I think that you should do this. I think that you can do both. I think that you can still be in charge of education and run the operations for the hospital. And I remember sitting down in front of the person whose job I would be taking going, "Well, what do you do every day?" And he was like, "I don't know. It's hard to articulate sometimes what it is that you do in a leadership role." So it was a new job that I had to learn. It wasn't something that I ever thought that I would do when I started nursing, but I found that I really, really loved it, and I loved, I loved education, but I also loved the operational part of the job as well. So again, when opportunity arises, I chose to go to South Oaks Hospital when that deputy CNO position came up. And I stayed there for 4 years until the day Maureen White called me and asked me to come here to Hofstra University. And again, it was probably a less traditional path. Now I'm in a leadership position. I anticipated becoming the chief nursing officer of one of our psychiatric hospitals. But this opportunity arose, and I thought it was one that I couldn't turn down because in my operational role at South Oaks, I missed education. I missed being able to teach the staff and help the staff. So I decided that, yes, I would like to, come over to Hofstra as the interim dean. And then I fell in love with it here and decided that I wanted to stay. So saying yes, I think, when opportunity arises.
Thank you. Justine, what is a misconception people have about flight nursing?
I think I'm going to use my own misconception that I had when I interviewed. I thought that we were just sitting waiting for a call, and it was a full team, and we were going to be moving really sick patients every time, being able to fly every time, and that's not the case, especially for pediatrics. The adult teams do their movement of patients very differently than we do. When a lot of hospitals do not have pediatric or neonatal capabilities that we do at Cohen. So sometimes we get calls from hospitals that are in Jamaica or Queens, and you can't fly there. There's no helipad, so we do have to move by ambulance sometimes. But if we do get calls out east at Peconic Bay, then we do have the opportunity to fly. Also, weather has a big proponent too. If it's raining or cloudy, we're not able to fly. So there's a lot of other things that go into it that I did not realize. I thought we'd just go up, we fly, get the patient, and bring them back. The team also changes depending on how sick the patient is. Sometimes I just go, sometimes it's me and a respiratory therapist, sometimes it's a full team with the provider when they're very ill. But there's a lot more that we do outside of just moving the patient than I realized.
Thank you. Lynette, how would you describe the breadth of opportunities in nursing?
Well, in a word, I would probably say endless. And I think you see some of that reflected here on this panel. Justine, as you talked about flight nursing and what you've experienced, what you thought it was and what it actually was, something that nurses have the opportunity to do that is incredible is take the knowledge that we have and use it to improve the way healthcare is delivered in any number of settings. So you've certainly heard from us here on this panel, but when you think about air medical transport and the fact that if you live in the boroughs, you don't have access to air medical transport, that has implications for the health of those communities. And so nurses can take all of the knowledge, skills, all of the strategic planning, all of the different experiences that we have had and create programs that enable communities to see better health outcomes. Nurses have always led when it came to public health, and that shouldn't change. So those things, I think sometimes people don't think about nurses in that capacity as innovators, as creators of new programs. People sometimes don't know that it was a nurse who was behind some of the great changes that we've seen in healthcare. But it all comes from being involved in care and looking at care delivery and outcomes differently and saying, how can I use what I know to enable a better outcome in this situation? Now, today, in the modern circumstance for society, we're seeing nurses in roles that we hadn't really even seen before. Nancy is a pioneer. She said she was a nurse since the early 1900s, but nurse informatics, nursing informatics has evolved so much as digital and technology industries have grown and healthcare has started to have a bigger footprint in that space. Nurses now are integrally involved in electronic medical record design, in different kinds of digital technologies. Many nurses work remotely or virtually, caring for patients who they may never actually physically come in contact with. Nurses work as consultants. There's so many different ways that that nurses can take what we uniquely know and sometimes take for granted because we don't think that what we know is special. We do what we do because we care. But in fact, what we have is a knowledge and skill set that's valuable in so many different ways. And so the possibilities are endless. Just this morning, I was in Manhattan at a digital health conference with a lot of people who are talking about AI and the role of AI in healthcare. And one thing remained abundantly clear, and that was that no matter how far we go down the AI realm, nursing will always have a clear and definitive part in healthcare of the future. So,
thank you. This question is for you, Nancy. Can you share an example of how your work impacts patient care without direct bedside interaction?
Yeah, thank you. So about 16 years ago when I transitioned into informatics, it was saying yes to an opportunity. And it was a little more of a newer world back then. And I struggled with it because I was like, I'm leaving the bedside. And to this day, I get asked if people see RN on my badge and they see I'm a nurse. They're, what kind of unit do you work on? And then they say, it's a misconception that you're not a nurse and you're not helping patients and you're not helping. The opportunity when I was a bedside nurse was to help my patients for the shift, the 2 or 3 that I had, to help the nurses that I worked with on a unit. But as Lynette said, there's 22,000 nurses, and everything that the team of informaticists do is impacting the daily life of the nurses, but then in turn impacting the care of the patients and how they interact with the patients. Main focus of what we do is to decrease the documentation burden, decrease the work on the nurses, and make your daily life better. Examples of this are, as we're building documentation, and we're going to be going more and more into using AI, and I'll talk a little bit about that in the future, instead of having to write it, take advantage of using voice to text. Or if you actually have to document something, make it work for you. Don't just ask the questions of the patients and when we're designing the content, but make that data that you're collecting actionable. You document something the patient needs, send that to social work and case management so that you don't have to interact and do anything. As we're rolling out more and more mobile devices for nurses, it's changing the way they work. You think about it, before they had mobile devices on the unit, every time you had to call someone, everyone you had to talk to someone, you had to go back to a nurse station, you had to walk to the center. Now that you have this mobile device, you can do that interaction wherever you are. And all of this time saving and documentation burden decrease on the nurses impacts every patient because now you have more time to spend with the patient. And that's really about what it's all about, is giving that care to the patient, doing what we love. I still love being a peds ICU nurse, but being able to better the lives of the 22,000 nurses at Northwell through the technology we give them, whether that's new virtual care, whether that's new mobile devices, or whether that's just an EMR that's smarter, and takes them away from living on the computer and being able to give that care to the patient. So that's really everything we do impacts that daily.
Thank you. Shannon, this question is for you. What bedside skills are most valuable as you transition into advanced practice?
Okay, so I think that there's a wide variety of skills that I've learned. So starting with my first job on a medical surgical unit, I think it was very foundational. I learned how to organize myself with multiple different patients. We would be assigned 5 or 6 patients. Often there would be a high level of discharge, and you would readmit patients, and then you learn how to work as a team, collaborate, delegate tasks, and I think time management, which has definitely served me well with a very busy full-time student lifestyle that I live now. And then transitioning into the ICU, I think it provided greater depth. We took care of patients who were post-op after heart surgeries, heart transplants, lung transplants, and these patients were very sick and unstable. So many times I was the only nurse at the bedside, and you form a lot of clinical judgment at this point. You recognize times when care has to be escalated to certain levels and to certain specialties, not necessarily what they were in surgery for, but you start to work with various different people who work in, say, kidney or gastrointestinal issues, and then kind of collaborate through that. Another skill, I think, going off of that is just communicating in general, clearly, confidently, and compassionately with families, with patients. And I think in at least the anesthesia realm, being in the operating room, you learn a new form of communication that you kind of adapt to, and you learn how important it is and critical it is, because I think that communication forms a lot of outcomes. And in an advanced role, I learned more and more that you guide systems of care, you get involved with protocols, and you start mentoring people, and I think communication is the basis for that. Another one, which I think is perhaps underrated and not necessarily you can learn through a textbook, but it's emotional intelligence. Nurses are often at the bedside during times of uncertainty, and they are very attuned to nonverbal cues of, say, grief or discomfort. They know how to de-escalate situations of tension and maybe provide silence in times when words are not necessarily enough. And I think that in an advanced provider role is important to build trust. So overall, I think that, knowledge and technical skills, they're important, but I think the bigger picture of clinical vigilance, communication, emotional presence, those are really the pillars that help me transition to the advanced provider role. And the best part of that is that any nurse can develop that no matter where they start.
Thank you so much. Bernadette, how has your advanced degree shaped your career in academia?
So advanced degrees have been the foundation in my academic career. My graduate education has provided me knowledge and skills to transition from clinical practice into teaching, curriculum development, leadership. And then at the doctoral level, I gained expertise in research, evidence-based practice, and that allowed me to contribute to scholarship, mentor students in inquiry. And all of this helps to advance the profession through nursing education and scholarship.
Thank you. Lynette, this question is for you. How do you create new opportunities for nurses within Northwell?
Well, I would say largely through two key approaches, exposure and partnership. And, I think today is even an example of what the partnership looks like. Exposure in that, as I mentioned before, sometimes nurses don't even see themselves as the leaders that they are because, you've come into the profession to help others and not necessarily to, self-promote or advance. But by exposing others to the breadth and depth of knowledge that nurses have, I have found that, number one, lay public, even other members of the healthcare team and leadership don't know how much nurses actually know. And it isn't until myself or other leaders recommend a nurse for an opportunity, maybe to help take on a challenge, to help work on a team, that then those team members are surprised. And they say, wow, I really didn't know that it would be so helpful and so wonderful to have this nurse on the team who understands operations, who understands patient flow, who understands clinical implications, et cetera. So exposure is huge. We do this certainly through informal means, but also through more formal means, leadership progression programs, fellowships, residencies, development programs. There's a heavy investment on the Northwell side. As I said, I spent many years in nursing education, professional development, and we've spent a lot of time investing in pathways for nurses to understand and be prepared for other roles. It doesn't always mean that they need to move out of their bedside role or whatever role they're in. It's just how they can join councils, become a subject matter expert, get involved in processes of change if it's in the role they're in or if they want to move to another role. And then in addition to that, partnerships. Partnering with other organizations, partnering with academic institutions, partnering with community-based organizations. All of these are ways that we create new opportunities for nurses. Because once again, it really brings in community and brings in others who may not have a full breadth of the understanding of all that nurses can contribute to whatever the issue is. You know, I say that nurses are certainly clinical experts, but nurses are also multitaskers, project managers, problem solvers. Nurses are creative. The list goes on. And so you take those skills, you know, and they really are transferable to many other areas. We have nurses running hospitals who are hospital presidents, but we also have nurses who are leading many other kinds of initiatives simply because of all that they have gained in their role as a nurse.
Thank you. Nancy, you mentioned AI before. So how have you seen nursing roles adapt to technology and more specifically AI?
Thank you. So I mentioned before that my team is rolling out multiple technologies for nurses and for all clinicians at the bedside. Before I get into a little bit more about AI, I wanted to mention that one thing that we always ensure we're doing is involving nurses in our design. So those opportunities that show up for nurses at the bedside, no matter what technology we're rolling out, I work with bedside nurses all the time. Opportunities Lynette talks about for nurses, I will partner with Lynette and reach out and say, I need nurses from every site because I need to involve them so that whatever we're rolling out works out for those nurses at the bedside. Because as much as I was a bedside nurse way back when, we'll leave it there, I am not living every day at the bedside with them. AI has become the big hot topic that everybody's talking about, and how do we use it? How do we incorporate it? And really, AI is not meant to replace that human factor. You need that nurse, you need that individual, you need it for that caring. It can't do the caring, but it's meant to augment and help you in your role. To take off that burden of work that can be done, whether that's documentation work, communication work, take that work off and put it on the machine. There's many ways that we're starting to use this at the bedside. When you roll out mobile devices to nursing, you now have a device that can listen. It can do ambient listening for you. So when you're in the room assessing the patient, talking with the patient, it can be listening, and then it can do that documentation for you. This has been being used with physicians a lot, because you think about when you go to your doctor's office and you talk with them, they ask you, how long have you had this? When did it happen? And it is a conversation back and forth. How this is going to impact the role of nurses is they're going to have to rethink how they talk with their patients to take advantage of this. And they're doing this across, I was just at a conference for EPIC, and they were doing this across the country, a lot out in California, where before they roll out the ambient listening, they're retraining their nurses on assessment, because you now have to kind of speak and talk your assessment with the patient so that it can take away the need to document all that on a flow sheet. We're also doing a lot with voice to text. So when you're doing the patient's vital signs, you can just speak them out and they'll be documented for you. So the time savings is great, but we have to think about nurses' role, partly how we educate nurses for them to have a better understanding of the assessment and have the conversation with the patient. On the other side of that, the impact on the patient that they've been finding is, because the nurses speak, instead of just listening to your lungs, listening to your heart, doing my full head-to-toe assessment, when I'm speaking out loud, it's prompting more interaction with the patient and an understanding of why they're going on the medicines they're on, or what actually is wrong with their body, or what they're going through right now. But it's a lot to get there. They're doing a lot of practicing on that way beforehand, so then that technology's rolled out and they can use it. The other thing that's starting to happen a lot is virtual care for nursing. We think of telehealth visits that we've had with our providers. Those have been around for a long time. But we're doing a lot of initiatives for virtual nursing, once again, to how you impact not only the nurse, but how you also impact the patient. So things we're doing with virtual nursing, which is nurses who are remote, either remote within a room in the hospital or remote working from home, they're doing admission assessments for the patient, something that might take a good 30 to 45 minutes to do. They're doing that. So that nurse at the bedside can focus on the caring and treating the patient's symptoms and being with the patient there instead of just obtaining a history. Same thing for discharge education, medication education. And what they're finding from the patient side of things is that the patient feels like they're getting so much time with all their nurses, because there's a lot more time with that nurse that's not running around on the floor really busy doing the care, doing the communication within the hospital. They have a lot of time with the nurse that's asking them the questions, and they're getting much richer information from the patient. On the other side of it, those 45 minutes for admission, 45 minutes for discharge, all the education time, that is giving back hours of time to the nurse, which is making their life then on the units more time for caring for the patient and quality of time that they're spending with them. It's just going to keep exploding, but I have to bring it back to as you work at the bedside as a nurse and these opportunities come up, we have to keep in mind that we have to talk with the nurses and we have to work with the nurses and not just roll out these technologies.
Thank you. Debbie, can you talk a little bit about how nursing helped you in terms of like projects or innovation with outreach in the community?
Yeah, many, many projects. So as I mentioned, I had the role prior to coming here, Director of Community Outreach, and I had to figure out what to do with that. Reached out to the Nassau County Department of Health. I knew they had nurses, and just got involved in innovative programs that would benefit the community coming from a healthcare system. So in a hospital, we have to take care of our patients internally and look at their health and wellness, but the role of healthcare and a healthcare system is also keeping the community safe and well. So there's many programs that have been implemented through this outreach initiative, but one comes to mind that I still love today and have to go and educate in October is child passenger safety. So when I think about that, it all focuses on injury prevention. And injury prevention is very hard to get funding for, because how do I have data to show I prevented an injury? But funding does exist in child passenger safety because there's other ways to look at data, motor vehicle crashes and deaths and what comes into the hospital. So one of the programs that I put together, and it started with funding from General Motors, was our car seat safety checkup events at the Children's Hospital. And I became a technician, and then I became an instructor. So that allows me to teach technicians, right, get my classes together so they can help at our car seat checkup events. And to me, I think that's empowering because we are doing injury prevention. Then the program continues today. Once a month, car seat checkup events at the Children's Hospital, because it's the misconception of, I've put the car seat in, for those of you that do not have children, I put the car seat in, I put my child in, and you go on your merry way. That doesn't work that way. And there's a lot of variables that go with that. So these car seat checkup events help not only the hospital in providing the education, but it also gives education to the families, and then they have the ability at the car seat checkup events to demonstrate that the education that I gave them worked, that they replicate putting the car seat in, they replicate putting the child in, and they demonstrate to me what we have taught them. So that is one of the biggest impacts that I feel proud about, that as a healthcare system we did and that we implemented that. And that's just all through what I've learned in the community and what the needs are.
Thank you so much. Christy, what is the most challenging transition in your career and how did you overcome it?
So So everybody thinks it's going to be coming from clinical to academia, but that actually was not the most challenging transition in my career. And it might sound odd, but it was leaving Zucker Hillside Hospital and going to South Oaks Hospital. And the reason that was so challenging is because I worked at Zucker for 22 years. And I started working there when I was 22 years old. So I grew up there. I really did spend most of my formative years as a young adult and earned all of my graduate degrees and everything while I was working at that hospital. I had progressive leadership opportunities. All of the programs that Lawnette alluded to, I was given the opportunity to go to as a nurse at Zucker. And I thought it was going to be an easy transition. I thought, when I decided to take the role at the other psychiatric hospital, it's almost the same thing. And it's going to be easy. But the hardest thing was leaving all of my coworkers, leaving my mentor, even though, you can still talk to them and they're only a phone call away. And then, landing at the new hospital wasn't quite what I expected it to be. It's a different culture. And so, when you're coming in as a leader, you have to somewhat assimilate to the culture of the new institution, but there's also an opportunity to try to change that culture for the better. So, it took me probably a good 18 months before I really felt comfortable in that new role at that hospital where I could start to really implement change and make an impact. And for someone who's used to working at a pace that's very quickly, that sometimes was frustrating for me. So it was absolutely a learning opportunity for me and a growth opportunity for me personally, because I never anticipated having those feelings and having that transition be like that. I think it helped prepare me for the transition, leaving the clinical arena and coming here to academia. I think I was a little bit more prepared mentally for a change like that, and it was something that I was looking forward to getting back into.
Thank you. Justine, how do you stay inspired and avoid burnout in such a high-intensity role?
I think one of the most important, and it might be hard starting as a new nurse, is making sure that you balance your work life. I know when I was first a new nurse, whenever they called for overtime, I always came in, always did overtime, but even doing that, it's a quick way to burn yourself out. So I learned with time that making sure that you keep time for yourself to do things that you enjoy is really important. And also making sure you take your lunch break and eat, because that's another way to burn yourself out. If you're constantly working and you're always going to have work, work will never go away, but you can eat your lunch because someone else will always be able to help, or the next shift can finish whatever you were not able to complete. In my current role now, I really enjoy it a lot because we do have time to do other things. We do a lot of projects. Even though we go out and transport patients, when we're not out, we do have a downtime where we can do other things. A few of my colleagues right now are working with our medical director in the PICU and the NICU. It's called a sinusoidal bronchotron. So basically, it's an oscillatory ventilator that we use for extremely sick pediatric patients. We're the only team in the tri-state area that can transport patients that need this type of ventilation. So they actually brought it, they presented it, and now they're actually working on getting I'm writing the paper. So we do have a lot of opportunity to do other things. So it kind of breaks up the high intensity and it really helps a lot.
Thank you. Lawnette, from your perspective as a leader, what advice would you give students about non-traditional roles?
Go for it. Right? Go for it. How many people here want to be a nurse? Okay, I see a few hands. And the rest of you, hopefully by the end of this presentation, you will want to be a nurse. Nursing has evolved so much over the years, and non-traditional roles it's not, I was going to say it's the way of the future, but it really is, it is the here and now. The majority of care at Northwell is provided outside of the hospitals. And, we have a very I think a traditional way of approaching nursing and healthcare, where we think that all nurses work in hospitals and work at bedsides, and it's actually a very narrow view of what nurses can do. So many of the non-traditional roles that nurses are entering into have to do with work outside of the hospitals. So whether that is in ambulatory care centers, many of you may have gone to an urgent care center or an ambulatory surgery center. Complex procedures that used to be done in the hospitals they're being done in outpatient settings now, and nurses are integral. Some of you, you might go to your provider, your primary care provider, and you might not even know that the person that you're seeing is in fact a nurse, an advanced practice nurse. We have Shannon here, who's going to be a registered nurse anesthetist next year this time, right? And so when someone comes in to administer that anesthesia, that critical anesthesia to you, might not realize that that person is a nurse. And so I think we have to do a better job for sure of exposing the many non-traditional and evolving roles that nurses have moved into. But as healthcare continues to evolve and care continues to occur in places outside of the four walls of hospitals and other modalities, as I mentioned technology earlier, as that continues to become more and more normal, if not central, in what the model of healthcare looks like, I think we need to start to adjust our curricula, start to prepare nursing students to think differently about what they want to do upon graduation. This idea that I should graduate and go work in the ED or in critical care, it's not a bad thing, but it's not the only thing. Mm-hmm. And there are many, many other opportunities for nurses, and I think it's an inflection point, an opportunity for us to stop and think about how healthcare has shifted. These non-traditional roles that are soon going to be not non-traditional because they're going to be normal, and how we are preparing nursing students for what is a new normal. As Nancy, as you talk about all the devices and so forth, it's fascinating, but it's exciting, and I think other industries have shaped the population to expect a different kind of outcome in healthcare. You order something online, it's at your house, the same day sometimes, or certainly by the time you get there. You come to healthcare, we give you a pretty complex and convoluted system to navigate. And people want a different experience. And we can provide that, but it will require nurses thinking differently and nurses stepping into roles that they hadn't traditionally thought about.
Thank you. Shannon, if you could go back and talk to yourself as a new graduate nurse, what would you say?
I think I would say you don't need to have all the answers, just the willingness to learn and grow every day. I remember coming out of school, working my first job, and it was a whirlwind of a year. There's a unique kind of pressure being new in healthcare. You have a fear of making mistakes. You have a fear that you're not moving quickly enough or that you don't have enough knowledge to do the job. And it can be overwhelming. What I wish I knew then is that what you learn is not immediate. It accumulates over time. Every difficult shift, every tough situation or patient encounter, every new skill that you fumble through, it's all part of the process of how you grow. I think I would remind myself that you don't need to be perfect in what you do. You just have to be present and be prepared to learn from others. I think that you can learn from every individual. It doesn't matter how far you are into your career. I think that you can learn something from everybody. I would tell myself to have grace. Nursing is definitely an art and a science. You're not going to master it overnight. It takes time. And it is normal to have difficult shifts, to come home. I've had shifts where I came home and I felt competent and I felt capable. And then there's times that I came home and I questioned everything and thought to myself, is this the right career? And I think that that's part of the work. I think self-reflection is something that moving into the advanced provider role has become a huge process. Every single day, you're self-reflecting on what you learned, what you can do better, and how you can learn more in the future. I think seeking mentorship is very important. You want to seek it early and seek it often. There's always people that you can learn from. My mentors earlier in my career, they were such a great resource. They provided support. They still are people that I can reach out to, and it's nice to have different mentors throughout. It doesn't have to be necessarily a nurse, but you can find mentors in various aspects of healthcare. You can find something everywhere that you go to aspire to become better at. And I think just trust the path that you're on. I would tell myself that the journey you think that you might be taking, it's not necessarily the one that you think from the beginning. And I think that this whole panel has spoke about how all these endless opportunities come up. And I think that taking that journey is important. Some of the things that I think you struggle with early on can make the path of where you're supposed to end up. So overall, I think to myself as a new graduate, to anybody starting out or thinking about being a nurse, I think be patient, ask questions, and be kind to yourself. I think that down the line, if you look back, you'll see yourself in 5 years and realize how much stronger and wiser and how much you've learned. And it just encourages you to continue that process.
Thank you so much. Just listening to all of you and just kind of thinking about my own journey, just saying yes to things is really important. Opportunities arise when you just you have an opportunity and you go for it. Also, like what Shannon was saying, is being, confident in yourself and knowing that you can do it, even if there are some hiccups along the way, and relying on mentors and others, because you'll never know everything. And when you do say yes to these opportunities, you won't necessarily know what you're doing. And so relying on those mentors to be able to take that next level, I think, is really important. I'm going to open it up to the audience. Does anyone have any questions? Okay. If there's any questions, you can step up. If not, I'm going to ask some questions of... So if you could highlight one skill or quality that's most important. Oh, there's a question. Sorry.
If no one else is going to ask a question, I'll ask a question. I'm a huge fan of nurses. I had nurse practitioners for both of my children, midwives, and it must be. I won't take that personally. And I just wonder, though, and I think I probably missed maybe the first 5 minutes, so maybe something was said, but I just wonder if you could reflect very sort of literally on the theme of the symposium. I could easily tell all of you the beauty of nurses and what they do, but I'm really interested to hear it from you. Some of it, I think maybe you've said just in why you became a nurse and what you do, but I just think it would be interesting to hear you speak of it in those terms, because at some level it's kind of what keeps you going, right? It's what you go back to when you think, I'm not competent or I can't do this, and I think many of us wonder about our jobs every day. So nurses are not alone in that either. But in all seriousness, I think what nurses do is so beautiful, and I'm just interested to hear any of you or all of you articulate that.
I can take that first. And I think the beauty and versatility of being a nurse is the humanism. And I think that's really the beauty. So, we go to work every day, and it doesn't matter what your specialty is. There's tough cases. You see things that are extremely sad. Or, in my case, in psychiatry, sometimes you get verbal abuse from patients. And, it's hard. It's a hard job. It's not an easy job. And nursing is one of the most trusted professions. And I think that's because we care. And it's really that human piece. Not to say that other healthcare providers don't, because of course they do. But I think it's it's the way that we are, and it's the way that we educate our new nurses. And I think that we've moved even further towards that. It's the holistic approach to looking at someone as a human being. So they're not that COPD patient in room 3 or that schizophrenic, down the hallway. It's a human being who happens to have schizophrenia or happens to have COPD, but they also have a family, and they had a life before they got to us, and they have a future that they're hoping for. And so I think our ability to interact with those people and to help them along their journey, I think that's really part of the beauty of nursing. So we have to remind ourselves of that when we have those really tough shifts or those horrible days. Or I said I was going to just leave it all and be an English major at one point and change my career totally because I got, upset. I'm very glad that I didn't because, it's really the impact of what you can do for people. And, and there are those days where you hear it back from the patient, from the family, and it really touches you. And it's very important.
I agree with you, Christy. And building on that, I think the beauty and versatility of nursing is that no 2 days are the same. It doesn't matter whether you are just entering the profession or whether you've been in the profession for a long time. There are no, even if you're working in the same setting, the people are different, the patients are different, their stories are different. And even though their diagnoses might be the same, how it manifests and how you interact with that situation is different every single time. And, that brings a level of freshness. Nursing is not a profession that gets stale, right? Because of that. Every time you have the opportunity to interact with someone and make a difference in their life is, to me, a very refueling kind of feeling. It's a very fulfilling feeling. I agree with what you said. When I worked as a clinical nurse, my indicator that I was doing a good job was when I would round at the end of my shifts and my patients would say, "Are you coming back tomorrow?" And when they said, "Are you coming back tomorrow?" I took that. I believed I did a good job. And that kind of feeling, I think, is something that it's hard to find in other professions, where someone has entrusted you with their life. And with every decision that you make, you can either improve or harm this person. It is nerve-wracking, as you've described. But what a gift, what a lofty responsibility to have and to be able to hold and nurture, than to be someone who is making a difference in the life of another person and family in the way that nurses do. So this theme, I think, couldn't be more poignant for nursing. I might go as far as to say that maybe this theme was designed for nursing, but I'm sure there are others who are speaking on the beauty and the versatility of other things. But I think it's just such a perfect fit for nursing.
And I am going to interject because I come from the pediatric world, and I often get asked, how do you work with pediatrics? And I say it really is the beauty of working with the patient and the family. I started my journey in adolescence, and for me, I love the educational piece. And we had eating disorders, and at the time, they were there for weeks on end. A few years ago. And I had a patient come back to me to find me and tell me, I went into nursing because of you. Mm-hmm. So that is my regenerating factor of why we do this, why I do this, and probably why every one of us continue to do this.
Great. Thank you. Thank you.
Thank you. All right. So I guess in closing, if any of you want to highlight a skill or quality that you think is most important for the future of nursing?
Yeah, we'll just go down the line.
Yeah. I would say, I think adaptability would come to mind. I think that nursing is constantly changing with technology, with evidence-based practice, research, something that you may learn, or a technique or a way to do something may be right when you initially learn it, and then it changes. And I think just being adaptable to new and current practices and being open to, again, learning, I think that is like the biggest theme for me.
Yeah, I would say agility for the reasons that Shannon described. So I won't repeat them, but nursing is a profession that requires agility in the present tense, but also in the future. We have to let go of some of the ways of practicing that we've been used to and really embrace a whole and new, different way of approaching healthcare. And that takes agile mindsets, that takes collaboration, it takes embracing interprofessional relationships, et cetera. And so agility would be my descriptor.
It doesn't leave a lot of adjectives.
Hey, how do you feel? I'm way out here.
I think, Shannon said it when she answered one of her questions earlier, emotional intelligence. I think it's, it's very important. I think it's going to be a key factor for people moving forward. It's not something we teach really well. It's a skill that you have to acquire and attain. And I think in the fast-paced environment that a lot of nurses will be working in, emotional intelligence is very important.
And I think the beauty and versatility of nursing is the many paths that we have in nursing. And I started off today at 1:00 stating that I didn't start my career in nursing. It was art and design. And had I been exposed to nursing, I most likely would have taken this earlier on and set a pathway while I was in middle school on what to do in high school. So I took a longer route. So for me, it's the pathways, but it's now creating a pipeline to allow middle school and high school students to learn what we just showcased here today, so that they can figure out a path that they may want to take, and if it's nursing, then set themselves up academically while they're in middle school and high school, so they can apply to nursing school.
I think it's important for nurses and nursing students to have an open mind, be present for any opportunities that come your way. Nursing goes from birth to death and everything in between, and we have such a privilege to be with those patients and those families at every moment of all of the points in their life. And it's so satisfying at the end of my shift when a patient or their family just comes up and says, "Thank you," because you've made some type of impact on their day.
I think a skill that I try to always do is that curiosity, a curious mind, tied to being creative and always looking for opportunities for innovation. Part of looking at how we do things. You come in as a new nurse to a unit that's been doing something one way for 15 years, and that's the opportunity to open your mind and say, ask the curiosity of why are we doing this, but also think of whether it's supported by technology or a different way of working, how can we change things and innovate them to stay current with the times?
I think an important quality is knowing that you will never know everything. We're always going to be learning new things. Things are constantly changing, and there's always opportunity from our education.
Thank you so much. As you guys were talking, just some things that, you said about just how we impact so many people's lives. Sometimes we don't even know. Debbie, you mentioned someone came back years later to thank you. You didn't even realize what you've done for that person. Nursing is so diverse, and there's opportunities, as you can see from everyone up here, different paths that we have all taken. As we bring this conversation to close, I want to thank you all for sharing your journeys so openly and for reminding us that there is no single path in nursing, only a profession full of opportunities to grow, lead, innovate, and serve. We have heard today reinforces that nursing is not defined by one setting or one role. It is defined by the impact we make, whether that's at the bedside, in the classroom, in the community, in leadership, or in the skies above transporting critically ill patients. Nursing adapts, expands, and meets people where they are, all while staying grounded in compassion and evidence-based practice. So thank you all for joining us today as we celebrate the beauty and versatility of being a nurse.